Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Have you ever felt like, even after you've conquered a really tough challenge, your mind still defaults to being on high alert, almost bracing for the next blow?
Yeah, like a part of you just can't quite shake off the shadow of that past experience.
Exactly. And if that resonates with you, our listener, you're tapping into something really surprising and, well, incredibly crucial that we're going to deep dive into today.
It's true. That feeling you described, it isn't just psychological. New research is showing that even after people recover from depression, their visible symptoms improve, but their brain might subtly keep this heightened sensitivity to negative cues.
So it's not just a feeling.
No, not just a feeling. It seems to be a measurable biological signature deep within the brain.
Wow. And this is precisely why this deep dive is so vital. We know depression has incredibly high relapse rates.
Staggeringly high. Up to 80% of people experience symptoms coming back within 5 years.
Which means recovery, as we've usually thought about it, doesn't always guarantee, lasting resilience.
Right. This research suggests true long-term resilience means more than just feeling better subjectively.
It's about understanding and maybe even retraining these deep-seated brain reactions.
Exactly. That's the real frontier if we want to tackle that painful relapse rate.
Okay. So our mission today is to unpack this groundbreaking new study. It was just published in Biological Psychiatry, Cognitive Neuroscience, and Neuroimaging.
And we'll bring in some insights from health news, too. We're going to look at what's happening in the brain, why this persistent sensitivity matters so much.
And critically, what it could mean for future interventions. We'll pull out the most important nuggets of knowledge for you, a shortcut to getting informed on this.
Right. Let's dive in.
So with that crucial context, how did the researchers, Dr. Henricus G. Ruhe and his team over at Radboud University Medical Center in the Netherlands, how did they actually design this study? How did they get at these hidden mechanisms?
Well, Dr. Ruhe and they specifically focused on something called aversive learning.
Aversive learning. For those of us maybe not familiar with that term, what exactly is that?
Think of it like this. It's a type of Pavlovian classical conditioning. Pavlov's dogs.
Right, ringing the bell.
Yeah. But here, your brain learns to associate something neutral, a stimulus, with an unpleasant outcome. Like maybe you flinch when you hear a certain sound that reminds you of a past bad experience.
Okay. Even if the actual threat isn't there anymore.
Exactly. Your brain has learned to expect something negative, and it's sort of bracing itself.
That makes sense. And central to this whole process, this brain's warning system, there's a small but crucial region called the habenula.
That's right, habenula. It's spelled H-A-B-E-N-U-L-A. Tiny region, but really potent. It's deeply involved in processing negative feedback and responses to, well, punishment or unpleasantness.
And the researchers thought that abnormalities here might stick around.
Yeah, they hypothesized that issues in this system might actually persist, stay active, even after the depressive symptoms themselves have improved, meaning this negative feedback center could still be acting differently.
That's a powerful idea. But finding the right people to study must have been tricky, right? Who did they actually look at, and how did they know they were truly in remission?
That's a great point. They were very careful. They recruited 36 patients who had a history of recurrent depression, but crucially were currently in stable remission. Meaning symptom-free. And importantly, medication-free for over 4 weeks.
Okay.
And they compared these individuals to 27 healthy control subjects. They were meticulously matched, things like sex, age, years of education, to make sure it was a fair comparison.
That sounds thorough.
It was. And it's worth noting, while most of the remitted patients had very low depression scores when they did the scan, a small number, just 5 people, did show a slight worsening of symptoms.
Oh, interesting. Did that affect the results?
Well, they didn't meet the criteria for a full new depressive episode. And the researchers checked. The core findings of this study still held up. They were still significant, even when they excluded those 5 individuals from the analysis.
Okay, good to know. So to actually peek inside this brain warning system, they used fMRI scans, functional magnetic resonance imaging.
Right. And for anyone wondering, fMRI is basically a sophisticated way to measure brain activity. It detects subtle changes in blood flow when different parts of your brain get busy.
And while they were in the scanner, what were they doing?
They engaged in what the researchers called an aversive learning task. It used a modified Pavlovian classical conditioning setup.
Okay, walk us through that task.
Sure. So participants were shown pictures on a screen. These were the conditioned stimulus. Then, about 2 seconds later, they might receive a small, unpleasant, bitter taste. Magnesium sulfate solution, actually.
Ooh, unpleasant.
Yeah, they confirmed participants genuinely found it quite aversive. They rated it negatively for both liking and wanting. That was the unconditioned stimulus.
Got it. Picture, then maybe a bad taste.
Right. But here's the clever part. The link between the pictures and the taste wasn't constant.
Ah.
So one picture might predict a bitter taste, say 80% of the time. Another picture, only 20% of the time.
Okay.
And then those probabilities would switch. Unpredictably, participants were told to try and find a pattern.
But the real goal was watching their brain's response.
Exactly. Their brain's unconscious response as they learned or unlearned these associations between picture and taste.
So they've got people in the scanner learning these potentially unpleasant associations. What specific brain signals were they really tuning into? What did they measure that gave them these insights?
This is where it gets really interesting. They used a computational modeling framework. It's called temporal difference learning.
Temporal difference learning. Sounds complex.
It sort of is, but think of it like your brain constantly making predictions about what's going to happen next. Then when something actually happens, it calculates how surprised it was. That difference between expectation and reality. That's the predictive error. Okay. Temporal difference learning allowed them to measure that surprise, that error signal, specifically around anticipating the bitter taste, not just when it actually arrived.
Ah, so the anticipation is key.
Crucial, because it helps pinpoint how the brain gears up for negative outcomes. And they didn't just look at the habenula in isolation.
Right, you mentioned connectivity.
Yes. They investigated the functional connectivity between the habenula and another key region, the ventral tegmental area.
Let's spell that out, too.
Sure. ventraltegmentalarea. It's an important midbrain spot that produces the reward neurotransmitter dopamine.
And its activity is thought to be regulated by the habenula.
That's the thinking, yes. They look at how activity in these two areas correlated, particularly in relation to that prediction error signal.
Wow, okay. That's quite the setup for peering into the brain's warning system. But the real payoff is what those fMRI images actually showed, isn't it?
Absolutely. Let's dive into the core findings.
Yeah, what did they find?
Okay, two major, really groundbreaking insights came out of this. First, they found what we can describe as a hypersensitive habenula.
Hypersensitive, meaning?
Meaning individuals who had recovered, remitted from depression, showed significantly increased habenula activity, but specifically when they were expecting punishment.
So when they saw the picture predicting the bad taste.
Exactly. Their habenula was more active before the taste was even delivered. And what's so crucial here is that this wasn't about how they consciously felt about the taste.
Oh.
Yeah, their behavioral responses, like how much they disliked the taste, showed no differences between the groups. The difference was purely in the brain's anticipatory response.
Wow. So it's like their brain was still subtly keeping its guard up, hyper-vigilant for bad stuff.
That's a great way to put it, still on alert.
Okay, that's incredibly powerful. What was the second major finding?
The second key finding was about disrupted brain connectivity. Remember we talked about the habenula and the ventral tegmental area?
Yeah, the dopamine area.
Right. Well, the remitted depression patients showed decreased functional connectivity between these two regions. And this decrease was linked to that temporal difference signal, basically. How strongly they were expecting punishment.
What does that decreased connection actually mean, though, in practical terms?
Well, what's fascinating is how these two critical brain regions communicate. If we think big picture, this decreased connectivity suggests a reduced ability to regulate responses to potential punishment. It's almost like a decoupling of how these systems normally interact.
Even when the individuals are feeling well.
Even when they're feeling well. That's the key.
And you mentioned earlier a link to lingering symptoms.
Yes, there was a connection there too. The study found a positive correlation. Higher habenula activity, that anticipatory activity, was linked to higher residual symptoms.
Even if those symptoms were really mild.
Exactly. Even if they were very mild, just subtle things measured by the Hamilton Depression Rating Scale. This association suggests that this heightened habenula activity might actually be contributing to those subtle lingering effects of depression that people often report even after remission.
So let's boil this down. What does this all mean for you, the listener?
It really highlights that even when someone no longer shows the obvious clinical symptoms of depression, they might still carry this heightened, unconscious sensitivity to negative cues.
And this lingering sensitivity that could significantly contribute to their risk of relapse, right?
That's the major implication. Imagine a future where maybe a quick scan after someone recovers could reveal if their brain is still quietly on alert in this way.
That would give doctors a potentially powerful new tool.
Absolutely. To personalize care, to maybe identify who needs more support, to proactively prevent future struggles.
The ultimate goal then is really impactful, leading to better ways to identify who's at risk.
And help develop more targeted interventions. Imagine therapies specifically designed to maybe sort of recalibrate this habenula response.
Therapies addressing these lingering brain sensitivities directly.
Exactly. Improving long-term recovery, preventing future episodes. It really shifts how we might think about what full recovery truly means.
Yeah, it really does. But of course, no scientific deep dive is complete without looking at the caveats, the limitations.
Absolutely. And it's important to be clear about those. First off, fMRI technology itself, while powerful, has limits, especially with tiny brain structures like the habenula and the ventral tegmental area.
The resolution isn't perfect.
Right. It can be challenging to distinguish very specific subregions within these small areas.
That makes sense. Did the researchers acknowledge that or try to address it?
Oh yeah, they definitely did. They took steps to ensure the specificity of their findings. They used advanced noise correction techniques, which helps clean up the signal.
Yep.
And they also compared the results to an adjacent brain region, the third ventricle, which is basically just fluid-filled space. They found no similar effects there, which helps reinforce that their findings were specific to the habenula and VTA.
So they did try to control for that technical challenge.
Yes, it shows good methodological rigor, especially given how difficult it is to image these tiny structures.
Okay. What about the connectivity finding? You mentioned functional connectivity.
Right. Another important point. Functional connectivity, the type they measured, basically tells you how activity in different regions correlates over time. It rises and falls together.
But it doesn't tell you which region is influencing the other.
Exactly. It doesn't specify the direction of influence. We can't say for sure from this study whether the habenula is directly inhibiting the ventral tegmental area or if it's the other way around or something more complex.
So correlation, not necessarily causation in terms of influence.
Precisely. Future research using different techniques, maybe something called effective connectivity, could potentially shed more light on those directional relationships.
Anything else methodologically?
Just a couple of other points the authors noted. They used predefined learning rates for their computational model,
Yeah.
rather than fitting them individually to each participant.
Is that unusual?
It's a common practice in some research areas, and they acknowledge it might not be optimal for every single data set. But they also mention prior work suggests this usually has a limited impact on the actual neural results.
Okay. And the sample, the people studied.
Right. This study had a high proportion of highly educated subjects. Now, this wasn't the difference between the remitted group and the control group. They were matched on education.
But
It could potentially limit how much we can generalize these specific findings to the broader population, which obviously includes people with all levels of education.
got it. So given these points, what's the main takeaway?
I think it's about recognizing that while every study has boundaries, these findings still add really significant weight to the evidence. They strongly suggest that aberrant habenula activity during this kind of aversive learning is deeply linked with depression.
And crucially, that it persists into remission.
Exactly. Even with the limitations, it strengthens that core message immensely.
Now, let's widen the lens a bit. What are other experts saying, and where might this research lead next?
Well, Dr. Cameron S. Carter, who's the editor-in-chief of the journal where this was published, Biological Psychiatry, Cognitive Neuroscience and Neuroimaging, he really emphasized something important.
What was that?
He pointed out that while we know quite a bit about how depression affects brain function during an active illness, there's been surprisingly little understanding of whether those changes stick around after recovery.
Right. That gap you mentioned earlier.
Exactly. And he highlighted that this new study clearly addresses that gap. It provides a crucial piece of the puzzle about the persistence of these brain signatures.
That makes sense. Now, you mentioned something interesting earlier, that these findings of increased habenula activity in remitted patients seem to contrast with some older studies.
Yes, that's a fascinating point. Some previous research had actually shown blunted or maybe even decreased habenula activation in individuals who are currently depressed during similar tasks.
Okay, that does sound like a contradiction. How do researchers make sense of that? Increased activity in remission, but decreased during depression.
It's a good question, and it raises an important potential distinction. It might be about the difference between tonic activity, think of that as like an ongoing baseline level of activity,
Okay.
and phasic activity, which is more like a reactive burst of activity in response to a specific event or stimulus.
Ah, okay. Baseline versus reaction.
Exactly. So one hypothesis is that the habenula might show heightened tonic or constant activation in people who are currently depressed, like sort of chronically on.
And that might reduce its ability to react strongly.
Potentially, yes. It might reduce its phasic or reactive responsivity when a specific negative cue appears. This new study, looking at people in remission, suggests they have a heightened phasic response, a stronger reaction to those negative cues.
So it's not necessarily a contradiction, but maybe a different pattern depending on whether someone is actively depressed or in remission?
That's the current thinking, yeah.
Yeah.
A more nuanced understanding of how the habenula behaves across different phases of the illness.
That's really interesting. And there was another difference between this study and some older ones, right? Something about the type of negative experience.
Yes, another key distinction. This study used what's called a primary reinforcer, that unpleasant, bitter taste.
Something inherently unpleasant.
Right, it has innate biological significance. Our bodies are kind of hardwired to react to certain tastes as bad. Many previous studies, though, used secondary reinforcers.
Like what?
Like losing money in a task, for instance. Money gains its negative or positive value through learned association, not innate biology.
Ah,
And the researchers here point out that how the brain responds can really vary depending on the type of negative experience. Is it a physical sensation, like taste? Or is it something more abstract, like losing points or money?
so the specific kind of negative cue used in the experiment could actually lead to different patterns of brain activity.
It seems very likely. It suggests that the type of negativity matters quite a bit for these brain responses, which could explain some discrepancies between studies.
This deep dive has really shown that recovery from depression is, well, it's a much more complex process than maybe we once thought.
Definitely. The brain, it seems, holds on to these subtle, persistent sensitivities to negative cues, especially in that small but mighty habenula.
So the big question then becomes, what does this new understanding of the habenula actually mean for how we think about full recovery?
Yeah, and what lingering vulnerabilities might be subtly shaping our responses to the world, even when we consciously feel well.
Could monitoring these specific brain responses, like in the habenula, become, I don't know, a future tool for personalizing treatment?
It's a really provocative thought, isn't it? Could it predict who might need more support after remission? Could it even guide the development of entirely new kinds of therapies?
It really opens up possibilities. Where does the research go from here?
Well, future research will definitely dig deeper. They'll want to explore if this habenula dysfunction is more like a stable, trait-like characteristic, sort of an enduring vulnerability that's always there.
Or does it fluctuate?
Right. Or does it fluctuate with changes in clinical status, as researchers put it? Does it get better or worse as symptoms change?
And can it actually predict relapse?
That's the million-dollar question.
Yeah.
Researchers will investigate if it can truly be used as a reliable predictor for relapse, and also how different kinds of negative experiences beyond just bitter tastes influence these specific brain patterns.
It sounds like this deep dive is really just scratching the surface.
Absolutely. It feels like the beginning of a fascinating new chapter in understanding and ultimately in finding better ways to treat depression and prevent its return.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.